Hey, ReMar nurses, are you here with me? I just said, you know what? I was doing Monday motivation prep and I said, I think I need to go live because we haven't had a pop-up study session in how long? It's been such a long time. And so as I was doing, going between the virtual trainer and the question bank, I said, it's time for us to do a study session. So we're going to do one. I want to look at a specific subject that I think you guys may be missing. And I just want you to feel so good about it. Like, I want you to be able to, when this subject comes up, you just know it and you can make like long-term projections about your client when you're taking your NCLEX exam. So I know it's Friday and I know probably a lot of you are like planning for the weekend, but we have to be studying because there are many of us who are testing soon. There are many of us who don't feel all that great about our content knowledge, but we know this is the year to get our license. And so what I want for ReMar is that even if you guys are not hearing from anybody else during this time, you know that this is the place where we study. So Friday afternoon, I'm not going to keep you long, I promise, but we have some studying to do. And just welcome everybody that's hopping on the Facebook page. I appreciate you guys so much. We have a lot of new people coming to ReMar Review. They have no idea what we do here. They have no idea that we have nurses passing my test, just like this nurse came on here right now. Nurse Big Bob Robert. Okay. Hey, I passed my test. Thanks for everything. That's what I want. That's what I want for each and every one of you. I want you to know that you can pass the NCLEX. And it doesn't matter how many times you've taken it. We don't care around here. We don't care. We just know that if you get to studying the right material and you address any other issues that you have, okay, that you can do it, all right? So I am just so happy that you're here. We're going to get into studying this topic. So let me get myself together. You guys know this is not a formal event at all. Nurse Rudy, hi Regina, thanks for everything. I passed my NCLEX. Thank you so much. Congratulations. What a great gift for this year. This year is crazy. 2020, nobody could have ever told me. You could have never told me that we would literally be having a year like this. But what I noticed is that, all right, Martha, Minnesota's in the house. I noticed Minnesota's in the house. But what I noticed is that through this total like pandemic, nursing has not, how can I say this? Nursing has grown. The interest in nursing has grown. The need for nursing has grown. The economy in nursing has grown. So listen, if you are thinking that this is not the place for you to be, I'm telling you right now, this is the place for you to be. You need to be in nursing, all right? And if nobody else is going to tell you this, I am. Listen, I'm your NCLEX instructor. I'm your mentor. I'm whatever you need me to be, but you need to be in nursing, all right? Because then you can literally, I'm telling you guys, you can literally plan your career out. And there's nothing better than that. Okay. Shout out to Maryland. Shout out to California, Northern California. Texas is in the house as well. New York in the house. Thank you guys for being all these people. The UK. Oh, I had a fabulous time in London last August. And I had the best fish and chips I've ever had in my life, ever. Miami, always. Hawaii, always. Lexi is in the house right now. Alabama in the house. Thank you guys so much. We're going to just do a pop-up study session. I'm not going to keep you long. It's Friday. I just ordered a pizza. I really want to eat it. But what's more important is that you guys pass your NCLEX. Yes, the bundle of joy. Hi, Tammy. It's good to hear from you again. Oh my goodness. We have a veteran and ReMar nurse on here. Tammy Russell, Pastor NCLEX. Check out her video. It's still very, very popular. Puerto Rico in the house, Boston, Bahamas, North Carolina. We had Northern California. Now we have Southern California, New Jersey, Connecticut. Everybody rep your city here. We got ReMar nurses all over the globe. I see you, Georgia. I appreciate Arlington, Texas as well being here with me. Kansas, y'all gonna have have me here all day just doing New York shout out Friday at ATL. I see you. All right. So what we're going to do, let me see if I can, oh my goodness, Egypt. Oh my goodness. All right, Ohio, that's what I'm talking about. All right, so what I'm going to do, and y'all forgive me because Mark is not here. All right, so this is my lovely window in Ohio. It's pretty beautiful out today, but I put my presentation on my laptop. So just listen, bear with me right now, okay? I'm not the technical person, I'm the nurse. Can y'all see this? All right, can y'all see this? Let me see if I can study this thing out for us. All right, this is some good stuff right here. This is a presentation, hot off the press. Hold on, let me see. Is that gonna work for me? Oh man, I need some prayers right now. Here we go. I don't want it to be crooked. All right. Yes. Is it good? Is this good? Can y'all rock with me on this? Let me pull it up. Can y'all rock with me on this? All right. So we're gonna be. Let me see. Do I like that? Do I like the way that look? Let me hold it here. All right. Okay, guys. So everything that we're going to be talking about today, we're going to do just a quick recap of this subject from the NCLEX VT, and then we're going to look at some questions from the virtual trainer question bank. Y'all know I just put out the VT question bank. However, don't get into that question bank until you have your content first. So we're going to just look at some content today. All right. So specifically, I want to do an endocrine review, just focus notes and tips. So if you have your VT student workbook, then this will be great. So I'm going to just slide this in here. If you have this book, all right, if you have this book here that goes with the VT program, you can add these notes to that, the endocrine portion of this. All right. So, here we go. All right. So this is the focus notes. All right. And then I promise I'll stay on, guys, for you, to answer all your questions at the end of this. So we're going to talk about the endocrine system, specifically, the parathyroid glands. But remember that the endocrine system, whenever you think about the endocrine system, whether you're in nursing school or preparing for your NCLEX exam, know that the major responsibility of the endocrine system is that they're going to be making and secreting hormones. So one of my first minds when I'm talking about endocrine is, okay, what hormone am I dealing with? Because the hormones are very powerful. They cause very powerful chemical changes in the body. And so if a hormone is off, I know my patient is going to have some sort of clinical symptoms. And that's what NCLEX wants you to be able to predict in the long term, right? That's what NCLEX wants you to be able to predict. And guys, this is all based off of content, all right? There's no strategy for this information. So we know that the hormones are going to be traveling through the blood. And this is just a quick chart of the glands, because you know the endocrine system is made up of glands and the hormones and the functions of the hormones. Now, you are responsible for knowing in-depth information about the way that the glands control functions in the body, all right? You don't have to have this chart memorized, but you have to be able to speak intelligently about these processes, okay? So if we're talking about the pituitary gland, you need to know where that's located. Am I looking for the pituitary gland in the abdomen? No, all right? What is its main function, its main responsibilities? You got to know that, yes, that's going to regulate growth, okay? And it's going to be one of the controlling glands in the endocrine system. All right, major gland. So if a patient has a dysfunction in their pituitary gland, what kind of things are you going to see? What kind of things are you going to clinically find? All right, and this is how you talk your way through this information. All right. The thyroid gland. Oh my goodness, super popular. You got to know about the thyroid gland because of the hormone that's produced and how that hormone is going to affect the metabolism, the oxygen consumption, right? How your patient feels, how your patient looks. The thyroid hormone will change the physical characteristics of your patient. All right. All right. Where's the thyroid hormone located? Okay. The parathyroid. What is that directly related to? There, what is the major concern of somebody that has too much? All right, PTH. What is the major concern of somebody that has too little? So we're just talking through this. This is how you should be approaching this information. Okay. Adrenaline. The adrenal glands, where are they located? What is the function? Okay. The testes, the ovaries, these are our sexual endocrine glands, okay? And they have specific functions for the male and the female anatomy, all right? So this is just the endocrine system. You have to be proficient in it, whether you're a nursing student preparing for the ATITs, or you are a graduating nursing professional preparing for your licensure examination, okay? So we're going to specifically talk about the parathyroid gland and just looking at this structure today, okay? And hey, shout out, you made it to a live ReMar video. We don't do this often on Fridays, but when we do, it's always a good time. So we're going to talk about the parathyroid gland. Remember, this is the endocrine gland. There's actually 4. Did you guys know this? There's 4 little rice-sized glands in the back of the thyroid gland. So they're very closely connected. I wish I should have put a surgical picture on here where you could see, like, literally it takes a specialist to be able to open up the neck and distinguish the parathyroid glands from the thyroid glands. They're really tiny, all right? So this is considered anybody that has anything wrong with their parathyroid glands and requires some sort of surgery. This is a major surgery, all right? Anything involving the thyroid glands or the parathyroid glands, your patient is critical. Your patient is critical, okay? All right. So just a general overview for you guys who've studied the topic. I just want to hit the major points. Remember, the parathyroid glands, when you see them on NCLEX, immediately think of the electrolytes, calcium and or phosphorus. Now, I can be honest and I can say I always see direct correlations to calcium, not phosphorus all the time, but they are responsible. They are responsible for phosphorus. So if we're talking about these two electrolytes, calcium is a major player in the body, right? So I just listed all of the things, and you guys probably know that calcium does all these things, but I just wanted to say them out loud so that we can acknowledge them together. So calcium, get that out of there. All right, calcium, normal heart rhythm, right? You need calcium to sustain your sinus rhythm, okay? Muscle contraction. Calcium floods into the cells, causes the muscles to contract. Of course, we learn in elementary school how important calcium is to bones and teeth, all right? That's part of what system? If we talk about the teeth, what body system are the teeth a part of? Does anybody know? What body system are the bones a part of? So the bones are part of the skeletal system. What body system are the teeth a part of? Does anybody know? Let me ask you this. Are teeth considered bones? Are teeth considered bones? All right. Nobody wants to answer? Teeth are not considered bones, but they are part of the skeletal system, okay? And I just learned that because I was teaching my daughter. I'm trying to teach my daughter. She's in 1st grade anatomy, and so we learned that. All right, so we are talking about the formation of bones and teeth, and how essential calcium is for those things. All right. Also, calcium is important for your GI tract and energy production. And so this is a major electrolyte. Okay. Phosphorus is essential too. It's mineral. So you're going to see phosphorus needed for energy production in the cells, and as well as it goes along with forming healthy bones and teeth. Okay. All right. All right. All right. So this is the distinction that you really need to have understood when you talk about the parathyroid glands, because you can have too little or you can have too much of the parathyroid hormone. And so when you do, what do you need to be monitoring your patient for? What is the treatment? All right. What is the treatment? What should you be as a nurse ready to anticipate? And so the content review should not take you long. Okay. The content review should not take you long. Now, so if we're talking about hypoparathyroidism, we're talking about too little of that parathyroid hormone being produced. And so normally, like the note says here, this can happen after a what type of procedure? Yeah, after a thyroidectomy. If the parathyroid glands are removed accidentally, sometimes, and I hate to say this is just my own personal bias, but sometimes at teaching institutes, large university hospitals, there is an influx of students, and students are allowed to, assist with procedures and sometimes do them. And so it is common, not just to blame students, but it is common for a parathyroid gland to be removed during a thyroidectomy accidentally. All right. And so anytime a patient has a thyroidectomy, you want to also check their calcium levels just in case a parathyroid gland was removed. Okay. Just in case. All right. Tag your friend. But he will definitely want me to do that for today. Mark, oh man, you messed us up. All right, let me see. I might have to go back to just lecturing this thing. See what happens when I try to go live, people. All right, I'm back. All right, this is the real deal. All right, questions here. So, so teeth are a part of the skeletal system. However, they're not considered bones, okay? Teeth are part of the skeletal system, but they're not considered bones. All right, let me go back to the presentation, and we can yell at Mark later. All right, so here we go. All right, so I was talking about after a parathyroidectomy. Let me move this over for you guys. Okay, after a parathyroidectomy, we have to monitor our patients, or even a thyroidectomy, we have to monitor our patients for hypocalcemia, because there's a direct correlation between the parathyroid gland and low calcium. All right, so if your patient was to have hypocalcemia, and I'm not going to tell you the signs of hypocalcemia because you should know them, and I think it's one of the questions anyways. Later on, we're going to do some questions. So I'm not going to tell you the signs, but you should know them for sure. But the treatment to reverse that state is going to be calcium gluconate. Calcium gluconate. All right. And if you're an RN and you are giving this specific medication IV, you want to know for your NCLEX exam, you have to give it carefully because it will cause tissue damage. And so necrosis of tissue means that the tissues are going to die if they come in contact with this medication. All right. And you should know that for any IV medication that a nurse is expected to give. All right. You have to give it in a safe way. Okay. All right. So here we go. we are moving on, and I want to look at the opposite. Okay, so the opposite is going to be hyperparathyroidism. So if you have too little of the parathyroid gland, you're going to see issues with low calcium. If you have too much of the PTH and increased secretion of the PTH, then the calcium levels are going to go up, which can cause what type of problems? What are the signs of hypercalcemia? What are the signs of hypercalcemia? Do you know what they are? If you know what they are, put them on the screen. If you don't know what they are, then what do you need to do? If you don't know what they are, then you need to look them up. You need to definitely look them up. Okay. All right. Because that's just a way for you to remember things longer than me just telling you this. A lot of the things that I'm telling you guys, you will forget unless you reinforce it through your own study. Okay. One more thing I forgot to mention down here. I forgot to say, I'm sorry, going back to the low PTH hormone is if you're giving oral calcium, you give those with food. And I apologize for that. Okay. Oh, I see the answers coming up. Bones, stones, and groans. All right. All right. Some people might not know what that means. I do though. Okay. So here we are back on hyperparathyroidism. Too much of that hormone, so the calcium levels rise. You can give this medication, alendronate. All right. You can give this medication, alendronate, for this particular issue. And I want to bring your attention to your, let me see if I can do it, to your quick facts book. If you have it in the back, you can see alendronate on here, okay? And the teaching for it, okay? So, quick facts for NCLEX 5-star version. Make sure you grab it. All right, make sure you have it. And this is how I like to combine the virtual trainer information with the quick facts information, okay? All right. So you want to, like, if the medication or the parathyroid hormone cannot be decreased, then they will do a partial parathyroidectomy, okay? And this is a surgical procedure that will remove some of the parathyroid glands. You really don't ever want to remove them all. You never really want to remove them all, okay? But the partial parathyroidectomy is the best choice for this condition. All right, does that make sense? So you guys have to master. You have to master this information between hypoparathyroidism and parathyroidism. And this is a concept that I briefly touch on in the virtual trainer, but I wanted to double down on it for this study session, okay? All right. All right, thanks, Martha, for putting those down. Okay. All right. Let's go on. Here. Oh, wait, here we go. Okay, or let's not go on. All right, I'm having all kind of issues now with this just because I paused it. All right. Okay. All right, let's do this question. There we go. Very good. Here's a question. I actually pulled this from the virtual trainer question bank. And it essentially says this. And we've done a content review. So you guys, you should know these answers for sure. Okay. It says here, a client presents with hypoparathyroidism. The nurse monitors for which symptom? And I apologize for the numbering. It should be fatigue. Number 1, fatigue. 2, tetany, night sweats, or headaches. Which one is going to be most appropriate if we're looking for hypoparathyroidism? Okay. And remember the electrolyte connected with it. All right. All right. I love it. I see you guys. You got it. You got it. Let me see if I just do that. Yes, so it is going to be tetany. Tetany is a clinical finding of the hypoparathyroidism condition, okay? All right, cool. And you guys can see that when you understand the concepts, the information, you guys can pull it very quickly from your brain. You don't have to sweat. You don't have to think about it. You don't have to use strategies or try to, eliminate, words or anything like that. You know it. And that's what I want you to feel when you're taking your actual NCLEX exam. All right, let's look at this one. Immediately, okay, I got this one out the question bank too. Shout out to you guys who have the question bank. Immediately following a subtotal thyroidectomy, the nurse plans to assess a female client for unilateral injury of the laryngeal nerve. The nurse should do which of the following? Okay. Is it number 1, palpate the client's throat for swelling? 2, ask the client if they are experiencing numbness? 3, ask the client to say their name? 4, asking the client if they are experiencing frequent swallowing. So this was a really great one that I had came across in the VTQ bank, and I thought, okay, there is a connection to laryngeal nerve damage when it comes to a thyroidectomy or even a parathyroidectomy, right? So what's the best way to assess for that nerve damage? What sayeth you guys? This is a pop-up study session. Thank you. You made it here. All right. So the correct answer, guys, is going to be, I see a lot of 3s. I see some 4s looking for frequent swallowing. The correct answer is actually going to be 4. Okay. Because remember, when you talk about the laryngeal box, this is the voice box, right? And so if a client has difficulty speaking, and I go over this in the VT, if they have difficulty speaking, then that's going to indicate that nerve damage, right? Right? Yep. So frequent swallowing, a lot of people pick 4. Frequent swallowing is hemorrhaging. That's going to be more connected to hemorrhaging. Yeah. So number 4 means bleeding. That's not specific to nerve damage. Okay. All right. Okay. All right. We're here. You guys are here. Let me see if I have another question. I think I have one more question. Are you guys ready for it? Okay. Did we get that one right? If we didn't get it right, just look at it again. Okay. Here we go. 3. Okay. Here we go. 3. A client is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab reports would expect which of the following changes in laboratory findings? So is it going to be number 1, elevated serum vitamin D? 2, low serum parathyroid hormone? 3, low urine magnesium? Or 4, elevated serum calcium? Okay. Here we go. All right. Which one is going to be correct here? All right. And this one should be very straightforward. Because it's just heavy content. It's just trying to determine, did you make the important connection that you were supposed to about the subject? Okay. All right. So this is definitely fundamental. This is definitely a fundamental question about this topic. All right. And I'm seeing that a lot of you did make the connection. So I'm happy about that. I'm happy the answers are rolling in. Excellent. Okay. So the correct answer actually is, all right, it is. It's the elevated serum calcium. So the parathyroid glands, they of course regulate the calcium. So if a patient has primary, all right, hyperparathyroidism, okay, so they have something, if something is called primary, then it's a direct result of that thing. So this is a direct result of their parathyroid gland dysfunctioning. All right, it's a primary cause. We would expect them to have elevated serum calcium levels. You guys got that? Excellent. All right, so this again was a study session because there is a process, and this is my Monday motivation early. A lot of people complain about the challenge of the VT. I see a lot of people complaining about the challenging question bank. The questions are too hard. The questions are harder than NCLEX. There's stuff in there I never studied before. And for the virtual trainer, it's the same thing. But literally, the process is not to punish you. What we do, what I do, everything I do for you guys is to prepare you. All right? So the virtual trainer first, and then the question bank, and then you pass NCLEX. That is my process. And I just cannot stress that enough. You have to go through it. And there are no shortcuts. There are no shortcuts. So right now, if you don't have the virtual trainer, you can get it. This is the comprehensive review. This is the lectures, the homework, the practice exams. Some of you guys are still off for the summer. You can get the VT. It is the best way to solidify the content, all right? And it's 55% off right now, so it's just $189. You guys know how much NCLEX reviews cost. I saw one for 4 days. It was $1,200, and you didn't even get a workbook with it, all right? And with the VT, you get the online review plus Quick Facts, which is the book I mentioned, plus the VT question bank, all right? Bring on the content and the questions. Yes. So that's what I'm saying. If you love the content that we just went over, I got it right from the virtual trainer. I literally picked out a topic from the VT workbook. All right. That's where all my content is. You want me as a private instructor? This is where I am in the virtual trainer. And then after your virtual trainer, we have the question bank now. So you can get an additional 1,200 questions in the VT question bank. There are questions in the virtual trainer. All right. You have this book filled with questions. There's homework. There's practice exams. All right. So when you get this book, you will have questions. But some people they just love questions. They just love other questions. And so now that we have the question bank, this is the process. So what I'm trying to say is that you start with the virtual trainer and then you get into the question bank. And every subscription that you get comes with the 100 question assessment. And that is just that's a one-time assessment unless you get the subscription with 2 assessments. But it's a one-time assessment where you go through it and it'll give you a readout of your content. Okay, it'll give you a readout of your content knowledge. And it starts at $29. So it's definitely a worthwhile purchase in yourself, okay? Into yourself. Okay, so that's the end of my slideshow, guys. I hope this was helpful to you. I normally don't come on Fridays. I normally don't do, independent study sessions. I'm actually getting ready to retire, temporarily retire for maternity leave. So I am hoping that I'm still able to connect with you guys. All right, I'll take your questions right now. We like to keep our products on sale, Rosalind. So I don't expect for us to take the virtual trainer off sale anytime soon, because honestly, we met with 2 schools and people are just literally finding out about the virtual trainer, and it's just a worthwhile solution, especially if you're, what we find is that nursing schools, they haven't really figured out how to have classes again. And so the virtual trainer is definitely a viable option for their students. Yes. Okay, if you have any specific questions about your specific account, go ahead and email support@ReMar Review, or you can Facebook chat us, because that is the best way to get your questions about your specific account answered. It's not me, it's Team ReMar. So you got to contact them, and you want to do it quickly because it's Friday and we don't work on Saturdays at all. And so you want to do it now. All right. All right. Yes, my prices are very reasonable and so worth it. Thank you so much. We try to keep our prices low. So you guys, we know you guys are students. We know you're students. How long is it good for? I don't graduate until June 2021. Okay, so that's fine. We don't have any, we don't have it. ReMar Review has been around for 10 years. We don't have any plans of leaving the planet. So you can still get your virtual trainer question bank when you graduate in June of next year. We have some senior nursing students that get the VT early, and they go through the content before their exit exams. But it's up to you. It's up to you how you want to do it. Can I only buy the virtual question bank? You can. You absolutely can only buy the question bank. I would say you got to check to make sure that when it's available, because our online question bank actually sells out. I know it actually does sell out, and the reason why is because it's a new product and we want to service all of the students in there. We have about 1,200 students in there right now. We want to just make sure that they are, having the experience they want to have, and everything is working well. So I think there are slots still open. Check out the website remarnurse.com and click on question bank to see if you can get in. All right. Thank you. The Lord is your strength. Amen to that. If my VT expired, can I purchase the question bank? Absolutely. The $29. The $29 is for the question bank. Okay. So the $29 is for the 1,200 additional questions, and you can customize them. It's for the 30-day subscription. In that $29, you get the 30-day subscription, but you also get the one assessment as well. If you want a longer time in your question bank, because honestly, 30 days is very quick. 30 days is very quick. So if you want the 60-day subscription, it's just $49. And then the 90-day subscription is $69, and you get 2 assessments with the 90-day. Okay. Can you reset the virtual trainer? Absolutely. You can do that under your profile section, and you can reset your virtual trainer. Okay, there. Do you recommend doing all 1,200 and then the assessment? Yes, I do. I recommend you doing all 1,200 because you're going to learn so many things about nursing in the 1,200 questions. It's called the NCLEX Virtual Trainer Question Bank because the major topics that I go over in the virtual trainer are in the question bank. But there's also some things that are not in the virtual trainer. Don't be surprised about that. There's a section called Fundamentals, and all of the questions are fundamental NCLEX questions. You guys know how I am about fundamentals. I don't go over that stuff, but I expect you to know it because you've been to nursing school. So yes, there's a question asking you, like, what's the procedure that removes the bladder? Like, what's the procedure that removes the adrenal glands? You got to know that stuff. All right. So don't get mad. The questions are challenging, but I wouldn't say that they're impossible to do. And the rationales are there for you to learn from them. Okay. All right. That's what I want to say about that. If my VT is expiring, do I need to renew it to do the question bank? You absolutely do not. No. If your VT is expiring and you're finished and you feel good about the content, then just move on to the question bank to round out your NCLEX studying. Okay. All right. Let's see. Are the modifications still scheduled to end September 30th? Yes, I get that question a lot. I get that question every time I go on live. Yes, I do not know about them changing after September 30th right now, but we should be hearing from something pretty soon. Okay. All right. All right. Things that I can answer. Thank you for joining me, guys. I still don't understand how to use the question bank. Okay. So that's okay. I can explain it to you. So the question bank is essentially, I'm going to try to pull it up on my laptop. Maybe I can, maybe I can't. It's essentially customizable exams, and we've done a lot of videos on this. So you probably can check YouTube to get a tutorial on it. but it's essentially a question bank where you can pick and choose the topics that you want to study. So for example, if you want to just do maternity questions, you can choose just maternity questions and build exams. Like they're customizable exams for you to study. All right. What type of birth control are able to be discounted? Oh, no. What type of birth control are able to be discontinued and begin becoming pregnant? I'm not sure. I'm not sure what you mean by that question. Can you rewrite it and send it? Because I'm not sure if you're asking. I'm just not sure. Okay. My virtual book fall in the water. Can I buy a new one? Your virtual trainer question book fell in the water. Yes, you can. Contact ReMar support at ReMar Review. Okay, about that. All right. All right. Yes, 10 years we have been in business here. How much is the VT question bank? Hey, if you want to know prices about any of the products, the best way for you to get all the information, like with graphics and details, is just to visit the website remarnurse.com. remarnurse.com. Okay? Can you guys do that for me? What I'm going to try to do, I'm going to try to upload. Let me move this really quickly. All right. So of course I'm in my homeschool classroom at home. What I'm going to try to do is log into my laptop and get on the website to show you guys the question bank. I know you've seen it before, but you probably are just like, actually, how does it work? All right. And that's cool too. Because I'm really excited about this product. Let me see how much. Oh yes. So with the 100 question assessment, you do get, you will get a readout of your score. So it's not like a passing percentage, because if you get, if you get a 50%, it's going to just say, okay, your content is such and such. So I want you guys to all get I want you to do as best as you can. But everybody will be different. Everybody will be different. I purchased the DVD package last year. Can I purchase the question bank? Yes, you can. You can purchase the question bank for sure. But just understand that I did the question bank really based off of the virtual trainer. So the DVD program was my older program. So there's a lot of stuff in there that you're probably not going to have seen, but you can still learn from it for sure. Okay. So what I have here, let me show you guys. What did I do? Okay, let me turn it around. Okay, so what I have here, this is what you'll get when you get the question bank. And I hope you guys can see this. It's probably not the clearest because it's so small. But when you get to the question bank, every subscription that you have, you'll either have two locations. You'll have the question bank or you'll have the assessment. Now, again, you don't want to do the assessment, in my opinion, until after you do the question bank. All right. So if you go to remarnurse.com and you purchase your question bank, you'll be sent a password and you'll be sent your credentials to log in. So when you hit the launch button, it'll actually take you inside of the VT question bank. Okay, can you guys see that? All right. All right. So the question bank, it allows you to, hold on one second. It allows you to create tests, and you can create tests here. And then you can also create tests over here too as well. But I'll just go here to create a test because I think we can see it better. All right. And so what happens is, like I was saying, you get to create your own exam. So whether you want to do like a tutor, where you get the answers right away, or you don't, you want to take a regular exam, you can do that. And you can pick like what kind of questions you want, what subjects you want. And this is very tiny, but the subjects we have: basic care and comfort. These are the large subjects: cultural competence, critical care, fundamentals, child health, mental health, management of care, pharmacology, med surg, as well as another child health, and then maternity. All right. So you can just kind of click, say you only, and then clinical math. So say you only wanted to do clinical math, and let's do some med surge. And then so down underneath, lessons will pop up that are related to that. And so you can even get more specific about what you want to study. And again, this is ReMarNurse.com. All right. Okay. So you can like pick, all right, I want to do dosage calculations, and I want to do adult health. What else do I want to do? I don't know. Let me go back up. I want to do some child health too. Let me do some child health and pediatric nursing concepts. Okay. All right. So, and then you can pick how many questions you want to do. All right. Is it okay to do all the subjects and lessons together, or should you separate them? It's up to you. Some people just want to go through it and take it like, okay, I'm only doing this subject and then this subject. Some people are incorporating them with, did I put that on Tutor? Some people are incorporating them with the virtual trainer. So like if I go over pediatrics, then they'll come in and then they'll do all of the child health questions. So it really just depends on you. All right. And so remember, there's over 1,200, like, so 1212 here. And you can, I'm just going to go through it again because I said I wanted to use some of the other ones that I didn't use before. So let me go through this again. Pediatric nursing calculations, and let's do dosage calculations and conversion factors. All right. So this is like a math. All right. So love it. Love it. I passed my exam. Shout out to Nurse Tasha. She passed her exam with 130 questions last month. Woo. All right. Okay. So again, you can create your own test and you just generate your exam, and it's filtering all of the subjects. And of course, we want to launch the test, and you can do this as many times as you want. And so this is a math question, obviously. So this is the NCLEX presentation format. All right. We have a separate one for LPN and RN. So this is the format. This is what NCLEX looks like, right? And so you can just write your answer here. Of course, I'm not really doing it. I'm just showing you guys. And you submit the answers, and it'll tell you if it's correct or incorrect and why that is. Okay, so if you put it on the tutor mode, you're going to get instant rationales. If you don't put it on tutor mode, then you won't get instant rationales. But this is a way. Hey, we got that one right. This is definitely a way for you to get some independent and customized practice exams in. Okay. All right. So, again, question bank, this is based off the virtual trainer information, starting at $29. Honestly, I don't think that anybody should, and we also have exhibits here for math. So can you count, this is pharmacology and math together. So this is a ReMar resource for sure for you guys, especially at that price. Every ReMar nurse should get this question bank because it's really going to be helpful for you. All right. If you want extra questions, like I said, the question bank already has a ton of questions in there, but this is just a way for you to have additional questions, and it'll break down your performance, how many you got right or wrong, and then how well you're doing in a subject. Okay. All right, guys. So I said I wasn't going to keep you long, and I promised I won't keep you long. That is the end of my study session for today. I hope that you guys are fired up about studying over the weekend and getting your nursing license. Okay. All right. So anything else, please email us, support@remarreview.com. Also, remarnurse.com is for any of the ReMar products. If not, I will see you guys on Monday. We have Monday motivation coming up. So new questions, new information. It's all live. We're going to go live as long as possible. Also, our next live big event will be my virtual baby shower and NCLEX review. So if you have not signed up for that, please do, because we will be releasing the workbook for that next week. And so you want to bring that workbook to the class, okay? Regina, can you please lower the monthly subscription? Yeah, so the monthly subscription, we actually lowered the monthly subscription for the virtual trainer from $69 to $29. So the monthly subscription for the virtual trainer now is just $29. Did you guys know that? Yeah. So check that out. We did that. We heard you guys, and that's what we do here. We really take, you know, what you guys want seriously. All right. Somebody said, how often do you do this? We do this all the time. Every Monday I go live and we do a study session on Mondays. So you can check me out there. Somebody says, how do we sign up for the virtual shower? Oh, if you go to, you're already on the ReMar page. So if you go to events, that should be the first event that comes up. That's the next event that I'm having. After that event, I'm going on maternity leave. So you guys will not be seeing me on the page. I may go live inside the virtual trainer, but I'm not sure. Okay. So check me out there. Thank you guys so much for studying with me. I appreciate it. I love you guys. I love the support that we have in this community. It's not like anything else I've ever seen anywhere. So you guys are amazing for that. But we always say this. Oh, it's okay if you cancel your VT subscription. You can reinstate it for the lower price for sure. So anyways, we always say this around here. We say, I can. You guys know it already. We say, I can. And we say it with a straight face, and we say it like for real. I can, I will, I must pass NCLEX. All right. And so, no, we just lowered that price. So it should be rolling out. It should be rolling out soon here. All right. And most people probably will see it at the beginning of the month. What is the beginning of September, if not sooner. All right. So we're just trying to help the next generation of nurses get in. Right. So that's the goal. Like, there's a nursing shortage. And so we want nurses to be able to come into the nursing profession. So I can, I will, I must pass NCLEX. All right. Bye-bye, guys.